Hi, today is Saturday, July 5th, 2025. I am your host for Proven Cures. My name is Sarah McLeod, and I am actually restarting this channel in light of recent legislation that is actually drastically cutting healthcare benefits to a large majority of the American population. Medicare is being cut, Medicaid is being cut. As a result of this, there will be a lot of small towns that are going to lose their hospitals, lose their outpatient clinics. A lot of clinicians who do not have their private practices, including doctors, nurses, and allied healthcare professionals, radiologists, and the sort, will be out of work. And subsequently, a lot of patients won't have facilities to go to for care. If they're able to pool their resources and travel miles out of town to get to a doctor, they very well may not be able to afford the medication. It's a scary time. And I left this channel last year to start a Bible study channel here on YouTube. You're always welcome to go visit. But the God of Israel is the God of the poor. And for me to do a Bible study channel where I apply biblical principles to real life situations and sit back and not apply the gifts God gave me to helping the poor and helping people who need this information, that would be really derelict of me. So I feel convicted in my spirit to restart Proven Cures. I am specifically looking for clinical research results, empirical data to show that there are certain nutraceuticals and lifestyle changes that can be implemented in place of pharmaceutical drugs that may no longer be accessible to you, and in place of, God forbid, doctor's visits or a visit to a physical therapist and so on, that may not be available to you. I scour PubMed for new information. Actually started last night, so I'm going to share some information with you today about a substitute for Prozac, fluoxetine, which is its generic name. So listen up. Also, please excuse my attire. I was actually getting ready to dress to go out and enjoy the summer sun. When I said, no, let me do this first, more important. Thanks for watching. So the title of the study is a comparison of petal of Crocus sativus L and fluoxetine in the treatment of depressed outpatients. A pilot double-blind randomized trial. Let's dissect that a little bit. Crocus sativus L is the herbal name for saffron being a food additive. It's eaten, I think, predominantly in the Middle East and Northern Africa. So the researchers basically studied the petal of the plant, the petal as opposed to maybe the bark or the root. So this is the flower of the plant, and compared it in the treatment of persons who are treated with Prozac. Fluoxetine is the generic name for Prozac, on an outpatient basis. Of course, outpatient being people who make visits to their psychiatrists on a regular basis as scheduled. This is a pilot, double-blind, randomized trial. Pilot meaning there weren't many participants in the trial. A pilot study is an early study just to kind of see how people do with something, if there's actually going to be any change or any efficacy, any usefulness in the use of this investigational product, in this case nutraceutical, in comparison to the standard of care, in this case standard of care being Prozac. So they don't have to enroll a lot of participants into the study to do early measurements. Double-blinded trial means neither the trial participants, the patients, nor the issuing doctor knew whether or not they were receiving the saffron or were receiving the Prozac, the fluoxetine. A randomized trial meaning maybe a computer, most likely a computer, decided who would go into which arm of the study, whether or not you would receive the Prozac or the saffron. So hopefully that explains the title of the study to you in better detail. It was published in 2007 in a journal titled Progress in Neuropsychopharmacology and Biological Psychiatry, 31st volume. Forgive me guys, I had to get up and help my mom with some heavy lifting in the house, and it got really, really hot. So I had to take off my lab coat. This clothes I'm wearing are clothes I was gonna wear before I got started, and the Lord convicted me and said, "You're not going anywhere today until you do what I asked you to do and get that video done." So here I am. This was my going out to touch the sun outfit, but ignore it. So I'm gonna dive into the abstract real quick. Researchers opened by giving us a little overview of depression being something that is even with the use of psychiatric drugs, there's approximately 17% of that population who are clinically diagnosed depressed that never shake the diagnosis. They live a lifestyle, a lifetime, of cyclic depression. Moments of up and down their entire lives. They say here that many herbs with psychotropic effects have far fewer side effects, and they can provide an alternative treatment or be used to enhance the effect of conventional antidepressants. A number of recent preclinical referring to animal studies, and clinical studies indicate that both stigma and petal of Crocus sativus plant, the saffron plant, have antidepressant effects. The researchers' objective was to compare the efficacy, the usefulness of the petal of saffron with fluoxetine in the treatment of depressed outpatients in an 8-week trial. So that lets us know how long the trial was conducted for. 40 adult outpatients who met the DSM-4 criteria for major depression based on the structured clinical interview for DSM-4 participated in the trial. Patients had a baseline Hamilton rating scale for depression score of at least 18. In this double-blind and randomized trial, patients were randomly assigned to receive capsule of saffron and this is where you want to get your pen and paper. So the dosage was twice a day, morning and evening, 15 milligrams. So 15 milligrams in the morning, 15 milligrams in the evening in capsule form of saffron. Versus group 2, which received Prozac, fluoxetine at 10 milligrams twice per day, once in the morning, once in the evening, for an 8-week trial period. In case you may be wondering scientifically, why saffron? Why did researchers choose to use saffron in this pilot study? It is because saffron has been found to have 2 components which inhibit the reuptake of dopamine, norepinephrine, and serotonin. And these components are known as crocin, C-R-O-C-I-N, and saffronol, S-A-F-R-A-N-A-L, if you want to do more research on that information. But that is the reason why these researchers chose saffron. Also, saffron has been used in traditional Persian medicine to treat depression, so it is not a new concept. There were studies that were conducted in the years prior to 2007. This study was conducted, or at least this was published in 2007, but the study was published in 2006, 2005, and the 2 in 2004, all using saffron and in comparison to other either placebos or the antidepressant drugs, imipramine and fluoxetine, just in smaller trials, meaning fewer patients. And all of those studies found saffron to be effective, similar to the use of imipramine, which is an antidepressant, similar to the use of fluoxetine, which is Prozac. Of course, in regards to placebo, it produces significant change because placebo is, by nature of what it is, completely ineffective. So that is the reason for the study of saffron. Okay. Before I jump into side effects, let me mention here that when they were explaining the episodes of clinical depression that participants suffered with prior to starting the study, it's quite interesting because those of us who have never been considered clinically depressed, when we think of depression, we think of bouts of sadness, days we cry, but clinical depression is much more severe. Clinical depression is something that can lead to suicide because it is prolonged. It is so prolonged. It's prolonged feelings of misery. It can be accompanied by agitation. It can be accompanied by anxiety. It can be something that keeps you from wanting to move forward with your life, even complete your daily living activities. It can be crippling. And when I saw the duration of the episodes of depression that these persons who were enrolled in the study claimed to have experienced, I was in fact taken aback and also elated to see that that the study was able to find benefit in the use of a food supplement. So what it says here is that persons in each group prior to the study, whether they were enrolled into the saffron group or the Prozac group, all of them had an average duration of clinical depression prior to the study ranging from 2.5 to 4 months long. That is a long period of time. That's like practically a quarter of a year of feeling out of control of yourself, out of control of your emotions. And all of them had a number of previous episodes ranging from 3.5 to 4 episodes on average. So that is quite notable. Let's look at what the side effects were for each group. The first one was anxiety. For 4 persons who were taking the saffron suffered anxiety, while 7 were in the Prozac group. Decreased appetite. 5 persons taking the saffron reported decreased appetite, 4 in the Prozac group. Increased appetite, 1 person in the saffron group versus 3 in the Prozac group. Sexual dysfunction, 3 in the saffron group versus 5 in the Prozac group. Tremors, 2 in the saffron group versus 5 in the Prozac group. Nausea, 3 in the Prozac group, 3 in the saffron group versus 4 in the Prozac group. Headache, 2 in the saffron group versus 5 in the Prozac group. Sweating, 2 in the saffron group versus 3 in the Prozac group. Heart pounding, 3 in the saffron group versus 2 in the Prozac group. And insomnia, 3 per group. 3 persons in each group. And that is all I see in regards to side effects, with frequency of side effects not being that much different between each group. Now for the excellent news. So, according to the abstract, at the end of the trial, petal of C. sativus, the saffron tablets, capsules, were found to be effective, similar to fluoxetine, in the treatment of mild to moderate depression. In addition, it says, in both treatments, the remission rate was 25%. What I'm going to dive into now, I'm going to look at a profile of the participants so we can see who the patients were, at least what their demographics were. I love it when they have these nice, neat tables, so I don't have to like dive into the paragraphs to get the information. It makes it easy for me. So we had 10 women in the saffron group and 11 women in the Prozac group. We had 10 men in the saffron group and 9 in the Prozac group. The average age of persons in the in the saffron group was 35 plus or minus 8 years. In the Prozac group was 34 plus or minus 5 years. All were diagnosed with clinical depression. In the saffron group at 31 years old plus or minus 7 years, and in the Prozac group 32 years old plus or minus 5 years. Medication history, this is great. So 15 persons who were in the saffron group had a history of being on Prozac, 3 had a history of being on nortriptyline, and 2 had a history of being on sertraline. So saffron, before going further, is a food additive. So if this is something that you want to try out in addition to your regular antidepressant medicine, you can, and see if you have a better outcome. I am doing this video and subsequent videos really for people, however, who can't get to a doctor, who can't afford the medications anymore because things have changed so drastically. And if you're one of those persons, this pilot study can give you a sense of comfort in knowing that if you can get your hands on saffron, you may still feel well without taking Prozac.